Today we're going to be talking about blepharitis, which is inflammation of the eyelid edges, and it occurs most often in the older adult and those with the dry eye syndrome. Reduced tear production, which will often lead to bacterial infection of the eye because tears inhibit bacterial growth. So we'll have itchy, red, and burning eyes, seborrhea of the eyebrows and eyelids with greasy scales and mattering of the eyelids themselves. Blepharitis is usually controlled with eyelid care using warm, moist compresses followed by gentle scrubbing with diluted baby shampoo and avoidance. You always tell them to avoid rubbing of the eyes. So if you remember blepharitis, baby shampoo helps with it. Warm, moist compresses. Make sure that you look at where if the patient is older, if they have dry eye, then we need to address dry eye, and we're going to talk about that later. There's a wonderful picture of blepharitis here, and you can see here where there's the matting of the eyelids and the redness of the eyelids themselves. Entropion, the way I remember is it's in towards, turning inward, which is opposite of extropion. So entropion is turning of that eyelid, causing the lashes to rub against the eye. It's caused by eyelid muscle spasms, result of trauma. Eyelid turned in usually will cause that red conjunctiva, and usually what happens with this is they have to do surgery because the patient always feels like there's something in their eye. Pain and tears can also be present. The eyelid is of course turned inward. You have corneoabrasions can happen, which can result from entropion. Usually the surgical correction helps this. This is a very good picture of entropion, and you can actually see how the eyelids, how the eyelashes are inflaming the cornea itself. That's a very good picture of that. The other one is ectropion. It's turning outward and sagging. So remember, entropion, ectropion, EC, turning outward and sagging of the eyelid, and that's usually caused by relaxation of the orbicular muscle. There's reduced washing action of tears leading to corneal drying, and that can lead to corneal ulcerations. And the way to surgery is the proper way to restore lid alignment. And this gives you a really good picture of the before surgery and then the after surgery. And we've all seen some people with ectropion. And it happens a lot of times when we get older as well. Hordeolum is a sty, which can be external or internal. The treatment is with warm compresses 4 times a day and antibacterial ointment, which can blur vision. To remove ointment, close the eye, gently wipe the closed eyelid from the nasal side of the eye, and then go outward. Most of us have all had a sty once or twice in our life, and they hurt. That's one thing. It's red, it's swollen, tender. The most common causes is from staph aureus or staph epidermis and or strep. The hordeolum usually affects only one eyelid at a time. Usually the vision itself is not affected unless they're putting the ointment in, which can blur vision. Management includes applying the warm compresses 4 times a day, antibacterial ointment, and when the lesion opens, the pus will drain, and usually then the pain will subside. Nursing interventions include instructing the patient how to apply the compresses, and in your book on chart 49-3, it gives you a step-by-step on exactly how you do that. And after the compresses have been applied, you can instill the antibiotic ointment and teach the patient to remove the ointment from the eyes before driving or operating machinery, and to remove the ointment, as we said before, have the patient close their eyes and gently wipe from the nasal side of the eye outward. Okay. This is a really good picture of a sty, as you can see it, and it just looks painful. And the chalazion is a inflammation of a sebaceous gland in the eyelid. It begins with redness and tenderness, and it's followed by a gradual painless, as opposed to the hordeolum. This is a painless swelling. Later, redness and tenderness are usually not present with it, and a chalazion protrudes on the inside of the eyelid, and the patient usually has eye fatigue, light sensitivity, and excessive tears from it. So the treatment is very, very similar to the hordeolum. It consists of warm compresses 15 times a day. 15 minutes, that would be hard, 15 minutes, 4 times a day, followed by installation of an ophthalmic ointment. And surgery also is an option for this patient. And here is a chalazion. The first one, as you can see right here, you can see that's more of the red and a little bit tender. And as I said, later the redness and tenderness are not present, so you just have this big looking bump, on the eyelid itself. Okay, that ends this session. It's a little bit after 7 minutes, and we will continue with dry eye syndrome next.